The method of central line placement has evolved over the years. Ultrasound is primarily used for insertion to guide the vessel access. This minimizes trauma to the vein and surrounding structures. The technique used is Seldinger or modified Seldinger for CVCs and PICCs. This technique allows a vessel to be accessed with a small needle through which a guide wire is inserted. A small incision is made at the wire's insertion site in the skin, and an introducer or the actual catheter is threaded over this wire into the vein. The catheter tip and introducer are tapered, so the vessel is dilated and trauma to the vein is minimized. Still, phlebitis can occur post-insertion. Chemicals like chlorhexidine that were not allowed to dry completely can irritate the vein. If the angle of insertion is too steep, the catheter could rub against the vein wall, or multiple sticks or internal rubbing of the needle on the vein wall has occurred, like poor technique. So all of these factors could start the inflammatory and clotting process. Phlebitis is the inflammation of the vein and can be painful. It can be due to mechanical or chemical causes. It can also lead to thrombosis. It is important to ensure that the peripheral inserted catheters are removed from the same side as PICCs to avoid irritating the above vein near the PICC insertion site. So blood pressures and venipuncture should also be avoided for the same reasons of irritating and impacting that insertion site. Phlebitis is treated with heat, elevation, and potentially anti-inflammatories. If the site remains symptomatic, the line may need to be removed. Thrombosis, or catheter-associated deep vein thrombosis, occurs when a blood clot forms near the insertion site or around the catheter in the vein. Technically, upper arm DVTs occur in the brachial, axillary, and subclavian veins, but a superficial venous thrombosis can occur in the cephalic or basilic veins, and they are also problematic. They're just not considered DVTs. These veins feed into the axillary and subclavian, so thrombosis could extend from them to a deeper vein. Catheter-associated DVT is often silent and doesn't have obvious signs and symptoms, but when symptoms arise, it is due to obstruction of flow. You may see pain, edema, and redness in the extremity, shoulder, neck, or chest. When a PICC is inserted, circumference should be measured and documented. If swelling arises, circumference should be double-checked and measured approximately 10 centimeters above the AC. CEA DVT is confirmed with ultrasound, but just because the DVT is present doesn't mean the catheter should automatically be removed and replaced. According to INS, if the catheter is functional, it's still needed, and it's in the proper position, it should be left in and treated accordingly with anticoagulants. Placing a new line is associated with a high incidence of a new DVT on the new line's site. So why risk giving the patient two DVTs when you can manage one?